As COVID swept the world, it was hard not to notice some people having strange, long-lasting, unexplained symptoms after getting COVID. Here at KSAT, we've done a long list of stories on what's called long COVID, a serious illness after you get the virus that can result in chronic, long-term, debilitating conditions. These patients went through hell trying to convince doctors and workplace managers that something was seriously wrong with them. Now the medical community just finally accepted long COVID as an official condition. And for those patients, this is vindication and hope.
Hello, I'm coming in. How are you?
This is an appointment 16-year-old Taylor Presson has every couple months, checking up on bizarre new symptoms that showed up immediately after she got COVID in 2022.
The fatigue was really extreme, but I could roll my ankles just by walking. I have rib subluxations, so at any one point I can talk to you and have a rib pressing into my lung. I slept a lot and I started to have a lot of full body pain, to the point that when I went to physical therapy, I taped both of my ankles, both of my knees, and wore ankle braces.
Her doctors would not relate these issues to COVID, calling her debilitating joint issues growing pains. When you were explaining your symptoms, what were the doctors' reactions?
Sometimes it was amazement, and sometimes I actually had doctors argue back with me saying that a human body can't do that, because I can dislocate part of my foot.
Her mom, Amy Presson, had to advocate for her daughter.
You've got that mama bear thing going on too. Look at your binder. Show us your binder. I mean,
my binder has like lab report.
She can be lighthearted now, but in the beginning, it was no laughing matter.
So you go from specialist to specialist and try to have your symptoms believed. I know she would come home and just cry.
But those tears dried up when they finally met Dr. Monica Verduzco Gutierrez from UT Health San Antonio. She's one of the world's leading experts on long COVID, the now official condition referring to the lasting, ranging symptoms that hit after a bout of COVID. She was just one of 20 people who, for the last year and a half, put a paper together describing long COVID. At the direction of Health and Human Services, the National Academy of Medicine just approved the paper, listing long COVID as an official condition.
Finally, you're no longer being told that's not possible or you're wrong.
We know that you can have a mild case and still develop long COVID.
Exactly, right.
Okay.
See, people, I had mine was literally like sniffles, like it felt like allergies, and so, and then I got long COVID.
Part of Gutierrez's passion is that she's also a patient. Her main symptoms, severe fatigue.
I could easily before go run a half marathon. I would go and run 3 miles and then not be able to run or anything for days and be very exhausted from that. The other thing was having, palpitations or having heart rate changes and feeling really bad with that. I also had really bad migraines and also was getting really bad hives and rashes.
The paper lists over 200 symptoms that could be included in a long COVID diagnosis. The main symptoms Gutierrez sees are autoimmune disorders like POTS, fatigue, heart problems, lung problems, migraines, diabetes, asthma, brain fog, or even dementia onset. The condition's designation is a huge deal, considering it can be confusing to doctors when a patient has multiple seemingly unrelated symptoms. The theory is that all organs can be affected and all issues could be caused in some way by inflammation. That's where the next step comes in, training medical professionals to spot these symptoms and immediately refer to a long COVID specialist.
So now how do we get it to the people at the front lines, to primary care, to, for their clinicians to understand the definition. Hopefully we start teaching about it more in medical schools and in residencies.
the solution then would be speeding this up and making sure that the education and dissemination is a key focus.
Exactly. Now it's getting it out there.
Getting patients in quickly is crucial because there are therapies helping ease these symptoms. Less than a year ago, we went along with Dr. Gutierrez to one of her long COVID therapies that she also prescribes her patients. It's called flow therapy, typically used for heart patients. It helps blood flow through the body from the legs all the way up. It's helped immensely, giving Gutierrez the energy and ability to work on this paper and see her patients.
They feel okay right now from what I'm feeling.
The godsend therapy for Taylor and many other patients has been constant physical therapy.
I haven't taped my knees in probably over 6 months. I haven't worn ankle braces in about a year.
Seeing her now, you'd never know she has long COVID. This girl is the busiest teen we've ever met.
Wake up at about 5 a.m. because I have to be at school at 6 to be an athletic trainer, because we just finished with spring football right before school ended. And then I have my usual school day of doing GT and college courses. And then after school, I become PEP officer, where this coming year I'm going to help lead a team of over 100 ladies.
The problem with therapy, it costs money, and for years, most long COVID therapies haven't been covered by insurance. Many debilitated patients also have had issues getting on disability. Gutierrez and the Pressons hope that now changes with this official medical recognition.
There was a report also made to the Social Security Administration to say, like, okay, these are the 200 plus symptoms. They can be debilitating adults and children.
But when more of these diagnoses are finally made, there needs to be more places for patients to go. There are only about 40 long COVID clinics in the country, not even one per state. Luckily, there's one at UT Health San Antonio, but the wait list is not short. Years ago, when we started interviewing these long COVID patients, it was up to 6 months. Now, thankfully, it's dropped to about 2. Gutierrez says UT Health now also has a grant to make their clinic a one-stop shop.
Meaning, like, when you come to see me, that also there might be a physical therapist that's there, or there might be the pulmonologist that's there if you need that.
Meanwhile, the other solution Gutierrez needs to see is more research on long COVID to find out things like, are people with certain genes more at risk? Amy's husband, Taylor's dad, also has long COVID, but sadly has not responded to any treatments.
His symptoms, dizziness, fatigue, he had lots of falls, had to start using mobility devices, cane, walker, a standard wheelchair, and just recently she ordered him a custom wheelchair because he can't even sit upright and hold his neck up. Like, he has such extreme muscle weakness that he has to be fully reclined.
So while the whole Presson family continues to fight,
Give me a deep breath.
they want the world to know this.
It really can happen to anybody of any age.
It doesn't matter if you're young or old or healthy or not, woman, man.
So if you're having trouble getting a diagnosis on some seemingly random symptoms, tell your doctor about long COVID. Get some tests run and see a specialist. You can call the long COVID clinic here at 210-450-6470 or head to their website. All of this information also on ksat.com. For Solutionaries, I'm Courtney Friedman.
Solutionaries needs you to be part of the conversation. Your comments below will help us tackle new topics and track down solutions. And don't forget to subscribe.